Jenn and Chelsea.
We'd made a fancy PowerPoint, but it's on
That's
its own.
just us.
So.
Yeah. Well, good evening, everyone. For those who don't know me, my name is Dr. Jenn Nylof. I'm a veterinarian and practice owner of the Thompson Veterinary Clinic. I'm pleased to be able to give this presentation jointly with Dr. Chelsea Lillbeck, my colleague, and more importantly, my friend. And I think the fact that we can do this presentation jointly is very reflective of Northern Manitoba and some of the partnerships that we can definitely make while we're up here.
I couldn't have said it better myself. To elaborate on what you were saying, when I was looking at going into practice, I looked, all of my practice opportunities were northern based. And I looked at the facilities that were available, what communities were like, and Thompson just stuck. So, believe it or not, I'm happy to be here after 3 years too.
Yeah.
So.
Definitely. So we're going to just touch base very quickly on some of our shared business successes, challenges, and opportunities. So most people know that the Thompson Veterinary Clinic, it's been around for a very long time, founded originally over 40 years ago by my mentor, Dr. Ken Bingham, who took me under his wing back in 2011 when I first decided that I wanted to become a veterinarian. And things kind of took off from there. But there have been a lot of changes compared to when Dr. Bingham was the sole veterinarian in Northern Manitoba. So we're very fortunate now to be able to offer 24/7 on-call veterinary coverage to pretty much Northern Manitoba. So although we're located in Thompson, obviously, basically north of the 53rd parallel, there isn't a veterinarian that's available typically after 5 p.m. on Friday afternoon. So we basically take all of the emergency cases from the Paw and anything north, Lynn Lake, etc. So that's one nice thing to be able to offer our community. Thank you. We also, for the last year, we've been able to offer something called a SNAP program, and it's a spay and neuter assistance program that offers low-cost spays and neuters for anyone. There's no entry requirements or income requirements. All it is a piece of paper that you fill out and a short paragraph telling me why you'd like to be included in the program. And to date, no single person has been turned down who's applied to that program. So that's something that we're really proud of. We've also developed a partnership with a lot of the local rescues, Thompson Humane Society, Northern Manitoba Paws in Need, Spirit of Hope Rescue, and that helps us provide services to a lot of the remote outlying communities. We've also altered our fees and rates over the last year, typically to a reduced rate to be able to offer services to a wider population. Some of the outreach we've been able to do, I've been very fortunate to be able to work with Girl Guides, a number of elementary schools to do things like book readings, building cat shelters for homeless cats and what have you. We're also able now to upgrade our medical record system to an electronic system which facilitates transferring medical records back and forth between different veterinary clinics. So if a person from Thompson is traveling, we can easily transfer those records.
All right. So some successes that I've established from taking over the Thompson Chiropractic Clinic. Again, my successor was Dr. Paul Pritchard. He was in practice for 31 years in Thompson, and prior to that he was actually in Scotland where he met his wife. Some differences between myself and Dr. Pritchard, I have been bringing in more modalities. Prior to being in Thompson, I was actually practicing in Toronto for a year, so I had a lot of extra advanced modalities that were available in different places, and I wanted to bring those into Thompson. I saw great results, great relief for patients, and so I said, you know what, why are they not here? This is where they need to be. And since bringing those in, just a massive reduced rate in different issues in shoulders, knees, and other areas of the body. So I've also taken additional soft tissue coursework, so not everybody likes to be adjusted, even though that is my primary goal as a chiropractor. So having different soft tissue modalities that people can we can incorporate into their treatments. And then taking things to facilitate women. I know a lot of women, when they get pregnant, you have to be a little bit more gentle with certain things, so having additional expertise for women while they're pregnant and going through their course, and then post-pregnancy treatment as well. I've also altered the rates and fees. I do spend a little bit more time with patients, so that I do have to take into account, but for some of the modalities that I have brought into the clinic, I don't own them, so they're all on lease and loan, so I actually have to pay for them while I'm using them per patient. So when I explain that to most people, they have absolutely no problem, and they're like, just get me better. But that is something that is that we are faced with. I have started doing online receipts and reminders for all patients, so now, instead of getting a little card, you have that option, as well as email reminders for patients and getting all your receipts emailed straight to you for your own online billing. And like Jen, I'm very fortunate that I can sneak into the classrooms every once in a while, do some book readings. I was asked this year to do and be a judge for the science fair. Unfortunately, just scheduling conflicts, I wasn't able to, but I'm hoping that next year I'll be able to do that. And then I've been getting a lot of support from the local medical professionals. Now, Dr. Pritchard, Paul was phenomenal at having amazing rapport with all of the doctors in town, and he still does, and I'm so thankful for the path that he paved within the medical community. I have pretty much all of the medical doctors on standby with email, and regularly will have, with patients' permission, have conversations directly to them, so to avoid any miscommunication and just help keep more of a team atmosphere for patients' health. And we've noticed that with that it's decreased often wait times for getting to the clinic, because I can often email a nurse practitioner or an MD. They'll be able to email me back with what their recommendation would be, and then we can go forward from that, because I know oftentimes it can be a 3-month wait to see your doctor, so why not decrease that wait? And if a patient doesn't need to see a doctor, well, and they can just stay in the clinic, then I think that usually decreases a little bit of stress on patients. I also have a wonderful relationship with all of the physiotherapists over at Horizon and occupational therapists at the hospital, so it's been really wonderful to have that. We're both going to talk about our business challenges.
I can probably start off by talking a little bit about it. So I guess one of the benefits of working in Thompson, and I will echo Andre's comments, and now I can't imagine anywhere else that I would call home. I love working here and I love my job, and I'm very privileged to be able to work with an amazing team of people around me and amazing people throughout northern Manitoba. And our service delivery, I really do believe, is a gold standard. And we offer everything from soft tissue surgery to ultrasound, x-rays, and wellness. I will also echo Andre's comments in that sometimes I wish that I could clone myself and have one extra person, or 2 or 3, because a big challenge is a work-life balance, especially with being able to provide 24/7 on-call coverage. After Dr. Bingham retired, I was very fortunate to also have another full-time veterinarian working with me. Unfortunately, she decided to head off back to Winnipeg, so there was a period there for a few months where I was by myself. I'm very fortunate. We now have another veterinarian, but who is a recent grad, so in the last 3 months we've become a teaching hospital, which is exciting, and I love teaching, but definitely kind of contributes to kind of a little bit longer days, but I love it.
So we have the same issues for ourselves with our work-life balance, but I'm sure you also understand that we don't get sick leave. We don't have like paid absences. We have, if there's a family emergency and something comes up, there's nobody to cover anything, and that's usually something that falls down is our patients are our clients. Like, you have to make sure that you're available and you're there. Finding staffing and retaining employees, I'm not sure how you're dealing with this, but it's definitely a challenge. And as a smaller business, I cannot compete with the larger wages of valet or the larger companies that do offer higher benefits or better, better benefit packages. Like, I'm not there, so that is something that I'm struggling with for myself. And we both would love an associate. I recently went to Toronto, actually. I was there for 5 days. I was in interviews with soon-to-be graduates, and I'm hoping, I've had 18 interviews and I've shortlisted 2, so I'm hoping that one of those will be an ideal candidate to come on. I was also fortunate when I started practice, after I took over from Dr. Pritchard, that I had an associate for a year, but like her, she was drawn to the big city, so that's where she is now.
So some other challenges that I am faced with fairly regularly is the veterinary medical equipment that we use on a day-to-day basis, whether that's our digital x-ray system or our ultrasound system or our anesthetic machines that allow us to do surgery. Those are very specialized pieces of equipment that are actually very difficult to service. So having trained technical staff coming up to Thompson happens relatively infrequently, and when a very important piece of equipment like an x-ray unit decides to not work any longer, that does definitely translate into fairly expensive costs for us to either have someone come up to service it or to replace that unit altogether.
I have the similar effects. I recently brought in a shockwave unit. I've already gone through the expended use of the machine, and so replacing a portion of the machine, which has to get done, was a little bit of a hit. But that's what comes with having equipment. You need to make sure that it's well maintained and serviced. I've sent out pieces of equipment that are still being serviced at the moment, so you just kind of have to make do at times. This is our favorite, media marketing. If we market, we're already in a backlog of patients. I would love to be able to market, tell people more about the services that we offer, about what I treat. But as it is now, sometimes people can't get in to see me for 3 days, and when you have an emergent care patient that comes up, I'm like, you stay to take them if you can, or knowing when your limit is. Like, Jen apparently doesn't have a limit. I do.
I try to set limits. It's my goal for 2018.
That's mine too. But it's really hard in the evening when you're close to the end of the day and you've been on your feet and you've been in surgery. At what point do you have to say, you know, my self-care, I need to go home and I need to eat some food before I can do anything more, or for me and you as well. Sunday afternoon or Sunday morning comes and I get a phone call to my cell phone and being like, is there any chance that you can come to the clinic? Yeah, I'm like, I need to put on pajamas, like, I need to get changed. But it comes with the territory, so media marketing is a little bit of a no-go for me. I have a media presence and a website that I created after taking over the clinic, but aside from that, I don't do anything on Facebook unless I'm telling people that I'm gone for a duration of time or something else has come up, like a new massage therapist.
So, in general, I think most pet owners in northern Manitoba are actually very respectful of my time and understand potential waits. But there are some who feel perhaps frustrated about wait times to either book a wellness appointment, and that could be vaccinations or surgery. And I understand those frustrations, but a limiting factor often is time, and not only time, space within the clinic. So right now, for example, my next surgical appointment I'm booking about April 30th to the first week of May. We have a fairly good wait list, so we definitely take advantage of any potential cancellations, but those are very few and far between. So in general, I would say the community has been very understanding, but it occasionally, and I understand, understandably so, there can be some frustration.
on the first day that I started practice, again on 2018, I had 8 no-shows in a 2-hour period of time. I had 28 people on a cancellation list. So this year I actually had to implement a cancellation policy that had actually been in place prior but never followed through with. So this year I have many patients who are warned and given, well, not warned, but are told and reminded that if they have an issue, to please provide the clinic with 4 hours of notice. Not a day, 4 hours of notice. If you can provide 4 hours of notice, we can probably fill that spot, get somebody else in, and it gives somebody else the chance to. And thankfully, people have been very wonderful with this, but occasionally the no-shows still occur. But overall, I'm actually able to get through my cancellation list and any emergent care patients who do come up on a regular basis, which I'm very thankful for. But last year was a struggle, and I finally had to put this into effect because of that. So I'm thankful that all of my patient base is very understanding and very appreciative of everybody else who does cancel if they don't need appointments or if something else comes up in their life, that they're accepting of that change. Another issue that well, not really an issue, it's like I love doing community outreach. I love going out and doing things at elementary schools. I like going out into public speaking events, but just finding the time to do it. When we're in practice from before 8 in the morning until I don't get home often until 8 o'clock at night. I'm like taking that time away from the practice because of paperwork and everything else. I can't always do that. So usually the community outreach programs that I'd like to do are the ones that I have to cut because patient care becomes my first priority.
I think one suggestion that I get most often as a veterinarian is, why aren't you out in the remote communities doing more? And the concern is very valid. And I think I would love nothing more to be able to spend more time, Norway House, Cross Lake, etc., either doing vaccination clinics or doing spay and neuter programs. And I have ventured off. But me leaving the community necessarily means that there is no veterinarian in Thompson to respond to emergencies or what have you. So that's been a challenge, being able to recruit another veterinarian, which I have now, in order to be able to do some of those things.
And myself as well. I've been contacted by Kiosk, Gillum, Churchill, and a lot of the other communities in the area to go and set up. But if I close down to go to the community, there's nobody here to take care of anybody in town who needs their care. So it's an adventure. The North is untapped. We have so many opportunities. I would love to have 3 of me. I would love to have 3 full-time chiropractors here and 1 person going to all of the rural and remote areas. And they would be working full-time. They would have absolutely no shortage in time and people to help, but unfortunately we need to convince and try and instill confidence in people to bring them up to Thompson, and that's what I'm finding the most challenging, is being like, I made this choice because I saw the positive outlook of the community, and I really enjoyed my time when I was here. I came up in June. That's how he got me. It was beautiful. Fishing on the lake. I should have come up in February. But even with the cold winters, people are so wonderful and friendly. It's hard for me to be that negative, because I mean, we become pretty fast friends and very reliant on each other for support, for lunch date and supports. And you know what, I would have never had that if we wouldn't have been here.
Absolutely, for sure. So opportunities, realistically, we need a minimum of 1 additional full-time veterinarian in Thompson. The northern Manitoba can easily support 3 full-time veterinarians, and right now we have 2, so we're actively recruiting for a 3rd. So some additional programs that I think would be especially beneficial in Thompson. We need an animal behavior specialist to be able to provide everything from puppy socialization to being able to work with aggressive or mistreated dogs in the north. So that's something we're also looking to bring into the north.
And I know we are both actually looking at new advancements of our own education. I've been looking at master's programs, but again, that takes away time from practice, so I need to find that good, perfect balance of bringing somebody into the practice so that I can take time to further my education. And Every time I do a seminar, which I'm leaving this Saturday morning to go down to Winnipeg for another seminar on dry needling and acupuncture techniques, but it's always tricky to get time away from the clinic to further your education, get continuing education points.
Yeah, it is a challenge. So for myself, I think a master's is definitely one of the things that I probably set as a 5 to 10 year goal. In the shorter term, improving competency with abdominal ultrasound, which right now is typically a referral procedure, is definitely kind of our short-term goal within the next 1 to 2 years.
Like we were both saying, the North is an untapped market. There are so many opportunities. I recently had a kinesiologist in the practice. Unfortunately, she followed her husband back to the East Coast, so I was really sad to see her go. But additional supporting workers that I'd like to see within the clinic or within the area would be a cognitive behavioral therapist. I have a lot of patients who have had really severe workplace accidents or like vehicular accidents on the highway driving to and from Thompson. Cognitive behavioral therapy would be is really what they're missing for their care. I can only do so much, and when you are so scared to get into a vehicle or go into an area or a location, I can listen, but I can't do much more than that. Sometimes the listening is all people need, but oftentimes in those situations they really do need professional help, and unfortunately I can't give them, and we as a community need to find somebody that we can bring in to provide that. Also bringing in an orthopedic on staff. When I was in Toronto, I had the pleasure of actually being in a clinic, and it had an orthopedic surgeon in the clinic 2 days a week after we had exhausted everything that we could do. So that is something that I would really love to see happen in the future. You want to touch on this?
Go for it.
All right. Now, our pet project. I like the puns. Anybody who comes in knows that. I actually messaged Jen and I said I had taken an acupuncture course, and my acupuncture course actually allows me to work on animals. While I was in the acupuncture course, they said, go home and if you have pets, practice on them. I'm like, okay. So I popped some needles in my cat, same points, and she just looks at me and she's like, what are you doing, Mom? I don't have children, my pets are my kids. She's like, what are you doing? And she just sat there and she like looked at the needle and she looked at me. She looked at the needle and she sat there. I was like, it's okay, girl. I pulled them out, put them in the little disposal container, and then she jumped really high. I was like, holy smokes, you haven't jumped like that in ages. She's the little roly-poly thing. Short legs. So her jumping, even to get up onto the bed, I would kind of snicker because I'd be like, okay, I'll help you up. And we ended up putting a little pair of stairs, like a little set of stairs up so that she could get up onto the bed easier. She didn't need the stairs after we did the acupuncture. It was incredible. I hadn't seen her jump like that or move as quickly in 5 years. So just seeing that, I had also talked to a couple of my friends and their dogs had hip dysplasia. So I practiced on them. And I said, well, what do you see? And she said, we haven't had to give our dog their medication for 4 days after we did the acupuncture. And I was like, holy smokes. So they were clearly happy. The dog was happy, and we didn't have to, like, all for it, but it was just a change. It was something different. And so I messaged Jen and I said, to actually do this, I need to be in a veterinary office, and I need supervision. So I'm not a vet, but I can do this for animals. And what do you think? And she went through and made sure that everything was appropriately, had the accreditations for. And so we started working together about one weekend a month. One Wednesday a month, not a weekend. No. So that's been the excitement. So acupuncture treats anything from arthritis and old age in cats and dogs. I haven't done it in bunnies, but my friend has. To hip dysplasia, knee injuries. I know oftentimes larger breed dogs have a lot of knee and hip issues, and a good friend of mine, his dog actually had 2 knee surgeries on his dog. He had fixed the one and then the other went, and so his veterinary back in BC said, have you tried acupuncture? And I said, that's strange. No, I haven't tried this. And he's like, let's try acupuncture. And so they started doing a course of acupuncture treatment on this dog, and he hasn't had to go in for the repair surgery on the other knee if he goes in for a course of the acupuncture once a month. So for him, they found that it's decreased the need for surgery, which I thought was pretty impressive. It also helps animals because of the digestive effects. Oftentimes when you give medication, humans, we know, stomach doesn't always feel great if we're taking certain medications. The same thing can happen to animals. So by using acupuncture, it decreases the need for any tummy troubles that they might get. So, and then just the other avenue is after surgery, sometimes adding a little bit of acupuncture needles, like 1 or 2 treatments, it speeds up the recovery rate so that animals heal faster. So that's what we started together. Does anybody have any questions or comments?